C-reactive protein CRP. Introduction. C-reactive epiprotein is an acute phase reactant synthesized by the liver in response to inflammation. It belongs to the class of proteins known as pentraxins and plays a crucial role in the body's immune response. CRP levels rise rapidly in the presence of inflammation, making it a valuable marker for various clinical conditions. Clinical use: inflammatory marker, CRPS, a sensitive marker for acute inflammation. Elevated levels are indicative of ongoing inflammation, helping clinicians identify the presence and severity of various diseases. It is used in monitoring inflammatory conditions such as infections, autoimmune diseases, and tissue damage. Infectious disease: CRP levels increase in response to bacterial infections. Monitoring CRP can assist in diagnosing and assessing the progress of bacterial diseases. Cardiovascular risk assessment: elevated CRP levels have been associated with an increased risk of cardiovascular events. It is used in conjunction with other risk factors to assess the risk of developing cardiovascular diseases. Laboratory interpretation: normal range. The normal range for CRP is typically less than 10 mg per liter. Values within this range suggest the absence of significant inflammation. Mild inflammation: CRP levels between 10–40 mg per liter may indicate mild inflammation, possibly due to a nonspecific cause. Moderate to severe inflammation: levels above 40 mg per liter are often seen. In more severe inflammatory conditions, such as acute infections or autoimmune diseases. High sensitivity C-reactive protein Hs-CRP. Introduction. Hs-CRP is a more sensitive assay for measuring CRP, allowing for the detection of lower levels of CRP in the blood. This increased sensitivity is particularly useful in assessing cardiovascular risk. Clinical use: cardiovascular. Hs-CRP is a valuable marker for assessing the risk of cardiovascular events, especially in individuals without traditional risk factors. It helps stratify patients into different risk categories, guiding treatment decisions. Like standard CRP, Hs-CRP is used to monitor chronic inflammatory conditions, but with greater sensitivity. Laboratory interpretation: lowest Hs-CRP less than 1 mg per liter is considered low risk for cardiovascular events. Moderate risk: levels between 1–3 mg per liter indicate a moderate risk. High risk: Hs-CRP greater than 3 mg per liter is associated with an increased risk of cardiovascular events. Conclusion: in summary, CRP and Hs-CRP are crucial biomarkers for assessing inflammation, infection, and cardiovascular risk. Their clinical use extends to a variety of medical conditions, making them valuable tools for diagnosis, prognosis, and treatment monitoring in diverse patient populations. Interpretation of laboratory values must be done in the context of the patient's overall clinical presentation and other relevant diagnostic information.